All right, I'll get us started. Welcome everyone to the Engaging and Empowering Communities Health Equity webinar. This is the second part to this series. My name is Daisy Ortega. I serve as the Director of the Community Health Training Institute, and we are providing this webinar to you for free today thanks to generous funds from the Massachusetts Department of Public Health. There's a huge commitment to capacity building on really important issues for folks who are working out in the community. So we're not sure if you joined us for the first webinar. This is a continuation of that conversation. It's fine if you weren't a part of it, but that is on our website if you want to check out the recording. So today we're really focusing on engaging and empowering communities, and our wonderful presenter Mo Barboza will get started in a few minutes and orient you to what we're going to go through today. Just wanted to go through some housekeeping here. So on your screen you have, hopefully you're seeing Mo's picture and the title, and also you can text Training Institute to that number you see below to get automatically added to our email list if you're not already on there. And we're also on Twitter as well. If you want to put in some information or questions or comments, please use our hashtag MACoalitions. And just to give you an idea of what's coming up, so we have some free, all of these are free, trainings and webinars. So the third part to this series, which is the Power Dynamics and Health Equity, in fact, is an in-person training and will be held in April. There's more information on our website about that. In the morning, we're going to have a facilitative leadership training that you're welcome to attend, with a networking session right there in the middle. If you want to come for the whole day, we welcome you. It's going to be in Worcester. And just to keep in mind the save the date we have coming up for two great webinars in May. One in thinking about engaging young people into your efforts and thinking about youth leadership engagement in general. And also a great webinar, communication tips and tools to strengthen how you talk about your work, how you do your work, etc. Our website is down there at the bottom so you can get more information. And then if you haven't been a part of a webinar before, just a little kind of crash course here. So we have a questions box here. You want to look for it on your doc there. That's where you can type in any questions you have for us regarding the content or any tech issues you're having. We welcome questions throughout the presentation, and there's also going to be points where we stop to ask you questions to give us info. We will immediately after this webinar send you an email that would include an evaluation of today's webinar. We would really appreciate you to fill that out so we can get your feedback. And we will also follow up with additional resources, links to the slide and the recording, and any other kind of resources you may find helpful. Again, there goes our hashtag, and that is our handle there on Twitter. And again, if you haven't seen the questions box, this is what it looks like. You can look for that on your handle there. So on that note, I will pass it on to our great presenter, Mo Barboza, who will take us through this afternoon.
Thank you, Daisy, and thank you all for signing up. I'm just looking at the names, some of the folks who I know and some folks that I don't know, so that's great. I see Lozita, and I see Karen, and I see Luz, and many, many more. That's just some of you will remember that particular strain of talking from Romper Room. So I just want to connect with people a little bit, those of you who remember Romper Room. But we are going to jump right in. We have some learning objectives for today's session. They are in front of you. I just want to make sure that we breathe some life into them by reading them out loud. So we're going to describe at least 3 aspects of mainstream U.S. culture that create unintended barriers to participation by diverse communities. We're going to identify at least 3 strategies to enhance engagement in your work by members of diverse communities, and identify at least 2 strategies for managing discomfort when working across differences. That's kind of in the course of the presentation. We'll start with just a little bit of a review for some of the folks who maybe didn't have a chance to access and go through the first webinar that was a Health Equity 101. It'll be very quick, and then we're going to jump right into really thinking about how do we recruit, engage, involve and empower priority communities, and why is it important to do that? So I'm going to ask folks to flex that muscle that's going to be using the question box by asking you just to use that question box right now to put in what are some health equity issues that you are working on or that you hope to work on. And I just want to get a sense of what are some of the issues that folks are working on. Is it housing? Is it diabetes? What are the spaces that you are working in? We'll let a few folks answer that, and then we'll go from there. All right, I'll give folks another like 20, 25 seconds to try to answer that. Again, what health equity issues are you looking to work on, or are you already working on? I just want to get a sense of what folks are working on, and then we'll get into it. Great. So I see some food and food access issues. I see housing and obesity, smoke-free stuff, tobacco, physical activity, suicide prevention. Great. Immigrant health, equity in general, violence. All right. About 10 seconds if anyone wants to add something before we go. Great. Thank you all so much. That just gives me a sense of where folks are coming from. As I mentioned, we wanted to start with just a review of health equity. One of the main things that I put forward to folks is that we have to be willing to see the inequities, and we have to be willing to see the problem. One way of doing that, and a really important way, is to disaggregate the data to make sure that we are looking at data that accounts for and is descriptive of the populations that we see suffering the inequities. And you'll hear this from me several times throughout the day, is that you need to have an analysis on race, power, and poverty to ensure that folks are having the difficult conversations that they need to have, that we are raising the issues that need to be raised, and that we are identifying where these issues play a role in the inequities that we see. Just a quick note on health disparities. I know many of you might be working on specific disparities. We define disparities as differences in the incidence and prevalence of health conditions and health status between groups based on, and this is not an exhaustive list, but race, ethnicity, socioeconomic status, sexual orientation, gender, disability status, geographic location, any combination of these, and obviously you could add things like housing stock or some neighborhood environmental factors, as well as immigration status and things like that. I have some great definitions from our friends at PolicyLink and from Healthy People 2020. One is that health equity is achieving the highest level of health for all people, so that everyone is getting to that highest level of health. Another is health equity entails focused societal efforts to address avoidable inequalities by equalizing the conditions for health for all groups, especially those who have experienced socioeconomic disadvantage or historical injustices. And this is a really important drilling down to say that the inequalities are avoidable, that folks are not experiencing the conditions that would help them to have health for everyone, and that a lot of these are based on, and we should give focus to those that are based on socioeconomic disadvantage currently and historical injustices in the past through the present day. We'll be naming some of these as we go, and important for you as you're thinking about the area of health equity that you're working in, to have an analysis that includes what has been the history around this issue. For example, if you're thinking about housing, if you're working in housing, how has redlining affected who lives in what neighborhoods you're working in? If you're working in a community that is where minorities are a very small number of folks in the community. How has that happened, and why were they not a part of the community before, and what has allowed them, or what has changed for them to be a part of the community now? Having that analysis also helps you to unearth some of the power relationships that maybe perpetuate some of the inequalities or are possibly good allies for what you're doing. We'll talk about that in a little bit. Another one from Policy Link, equity means just and fair inclusion. And I really like the bottom one here, whereas an equitable society is one in which all can participate and prosper. The goals of equity must be to create conditions that allow all to reach their full potential. Equity creates a path for hope to change, from hope to change. It's making equity something that's very active and that we've got to be involved. It can't be a concept up in the air that we're kind of reaching for. It really has to be something that we are not only purposely creating today, but purposely working for tomorrow. Thanks to our friends at Policy Link. This is one of my favorite pictures for this work. I think we even tweeted this one out, so I want to make sure that we shout out Policy Link for it. It's really describing the difference between equality and equity, and so one of the things I like to point out to folks is that we all want the people here to be able to see the game. That's the kind of desired outcome. That's the equity that we'd like to see, and that the current conditions are such that even though they seem equal, this is the panel on the left, that they are not providing the same outcome for folks, for everyone together. And so equity really means aligning the resources, creating the social conditions that ensure that everyone has the same outcome. And so we're talking about health equity, so same health outcomes. And honestly, I want to make sure that we also say, the best possible health outcomes for everyone. Everyone being sick would not help us. And notice that it's a redistribution of the resources that are available and changing the conditions to create the outcome. Some folks will say, well, why don't we just get more resources here in the picture identified as those boxes? But if you notice, we would have to get a lot of boxes to even it out, to have everybody be at the height that the first person to the left is, including the person in the middle who at this point we're not having to recondition or recreate conditions for. And as we know in public health, there are not a flood of resources coming. So we have some opportunity to use what is currently in place and realign, redistribute, and maybe make some changes in the conditions so that everyone has the same health outcome opportunities and really equity. Hope that was informative for those who hadn't had a chance to review the first webinar. If you have not, I'd still ask you to do that. One of the things that we did in that first webinar was also to look at these 4 questions, and these are the key questions on how health equity impacts a system. Who benefits? So who is benefiting from the current conditions outside of causality? So they may not have created the conditions, but they benefit from how things are. Who pays or who is harmed? So who is actually harmed by the system as it exists, or by the inequity as it exists? Who leads? Who are the folks who are the advocates and the leaders on both sides of the issue? And then who decides? Who has the decision-making power in that space? And that's a really important one to think about, because who decides might be people who are not part of the group that's being harmed. Who leads might not be people who are part of the folks who are being harmed. And it really says that even the folks who are benefiting might be the folks who can change the condition and help to create the equity. And that's why bearing out the analysis would allow you to think about some allies. There may be people who have no idea that they benefit from how things are, who might be willing to create change, as well as those who currently are benefiting, who you may be able to sway. This analysis also allows you to have different voices name these different players and think about them from different perspectives. I'd encourage you to do this on an ongoing basis, at least once a year, with the issue that you're working on, to clarify some of your understanding of the issue, but also to continue to identify allies and others who may fit one of these categories who you may need to affect. Good. I know we're going fast. I just want to give that as a quick overview. I think I want to address something that has come up in many of these, which is how does the majority population affect change when the minority population is the targeted community or the community that's being harmed? I think you're naming part of what we're doing today. One way is to ensure that the minority communities are being a part of what is happening and that they are a part of creating the solution as well as implementing it. And the other is to think about what power that majority population has and what they can do. Another thing is that we're approaching a precipice where the idea of majority starts to mean a little bit less. Demographics are changing in many places, and across the United States we're going to be a quote-unquote minority-majority community at some near point. Some say as soon as 2050. And what that really means is that it won't necessarily be a question of a minority or minority populations being identified as those who are being harmed. We may be in a situation where a majority of the folks are suffering from the health inequality. And so it's really important that we start to make some headway and make some changes now to reduce, obviously, the suffering, getting as many people in a place where they are not being harmed. But thank you for that question. We're going to move forward. Some of you will notice what this picture is. This looks like something that happens in many communities. This gentleman looks like he's trying to file some kind of petition or some kind of paperwork, and you've got this body that has power that is going to decide whether or not to accept what he is filing and what he is asking for. This is a picture that happens, I think, in government quite often. It happens in some other spaces, perhaps academia, definitely in the judicial system. But it shouldn't happen in community. The community and the folks who are suffering through the inequities shouldn't have to go and present their case and convince others as to whether or not it should be something that needs to be done something about. So we're trying to reframe what this looks like, and we'll show some pictures later on. But I want you to be thinking about that it's not like the decision-making has to be held in one space and that other folks have to come there for it. And that's going to be an important part of how we think about engaging and empowering the target populations or the priority communities that we are working with. Last time we looked at some practical steps, and I just wanted to highlight some of these and talk a little bit about why engaging and then really deeply involving targeted communities or priority communities is going to be important as early as possible. Now, unfortunately, what usually happens, the traditional process is the experts and sometimes us public health folks, we get counted in this also, we go through all of these steps, and then when it gets time to act, we go and try to fetch the priority community. So we're going to go and outreach to the Haitian community once we have the plan, the data, the analysis. We've done all the work on this, and now we want to go and see if we can get them involved. Makes it really difficult, makes our solutions really poor when we haven't taken the time to engage and involve folks ahead of time. Some of you are already out the gate with your projects, and that's fine. It's just a space to maybe take an analysis and say, is there an opportunity to redo some of these steps and engage the priority communities as in an earlier phase than where we are now. So many folks have said, oh, we can involve folks in the planning, and at that point we're asking folks if if they want to be involved in something that we already have kind of put the ideas together for, and they can give us some ideas about what should happen based on what we've told them. Again, well-meaning, we're doing, a good thing by engaging folks, but it's a little bit far down the line. So I want to spend a little time thinking through with you the benefits of engaging folks in some of these earlier steps. So gathering data and disaggregating the data, having folks from that community be part of the process of looking at the data, gathering the data, some participatory research opportunities, disaggregating the data, having them bear an analysis and see the differences between groups, helps to empower them in terms of the access that they have to the data and the knowledge, and puts them on an even footing with the other participants in your coalition or the groups that you're working with, so that they are as informed and have an opportunity to inform the data itself. They will help you to make meaning of what you're seeing in the numbers from their experience. Be bold, have the conversation. It's amazing to have a conversation about a group without them in the room, but we do it all the time. So if there's some opportunities to have them engaged, if there are spaces where they can be part of that conversation as early as possible, I think you get a better result. And we try to encourage folks to have an analysis on race, power, and poverty. Having the affected groups in the room will make this a richer conversation and give you an analysis that might give you different answers than what you've had before. This is particularly important when we're thinking about groups who have less power in society. So you're thinking about perhaps women or young people, the elderly, immigrants, who societally may have different levels of power in your community. Really important that you state this stuff up front to see the differences and have an analysis on it in a space where folks are clear about the impact on those groups before you move forward. The next 3 steps are examining existing disparities, looking upstream, and answering those 4 key questions. I think it's pretty clear that you would get better answers to the 4 key questions if you have communities, priority communities in the room, especially if you're engaging across difference. Having them be part of naming the who benefits and who is harmed is empowering in of itself, and you're giving language often to things that folks are experiencing and feeling, but not always feeling validated for. So that can be a really powerful way of bringing folks into what you're doing, and having them be significantly part of the process. Looking upstream and examining the disparities, much like looking at the data, having their eyes on things may give you some different answers than what you may have gotten to by yourself. Targeting the change. This is really important because sometimes we create targets that are about the group and not about the change itself. We make some decisions that are about changing a behavior that we don't always understand completely, and we may make some targeting that fails to actually get to the root of the problem. And so having the priority communities, and here we really mean the communities who have been targeted. I hear folks with a different space or a different language when they get to talk about themselves. We've got a question, and I want to hear a little bit and give folks a chance to ask some questions. This one is about engagement fatigue, where groups want to go listen to people experiencing disparities, but those people don't have the time or have done it too much with no benefit. Thoughts on how to be authentic and offering meaningful ways to be in the room together. We're going to dive into that a little bit. The first one is it can't be that we just go and listen to the groups who are experiencing it. They need to have a role in what we're doing, and that would be the hook for their participation and engagement. We used to do a lot of focus groups as a way to learn about what was going on with a community, and I think that still plays a good role. But if we're presenting and we're going to actually be doing interventions, we need to engage those communities in designing the interventions and in implementing the interventions, finding ways that they can own the change that we're trying to make with them and never really be in the space where we're trying to make change for them. And we're going to push a little bit on that as we go, so stay with me on that one because it'll come up in some of our strategies as we move forward. Finding allies and points of leverage. Oftentimes the communities that we're trying to serve will have allies that we don't know about, partnerships that we're unaware of, and opportunities in terms of leverage points that we would not find. So they may be able to help us get there. Obviously in planning and acting, we want these communities to be in the forefront and want them engaged and finding ways for them to be really part of the apparatus that makes it happen. So that's what we want. There are some things that get in the way, and so I wanted to make sure we highlighted some of that before we get into kind of steps and strategies. So I'm going to ask you to, again, flex that question box space and give me a sense of where is it that you think folks struggle to participate. Why is it that they aren't participating right now in your efforts? Why are you struggling to get communities of, or these priority communities, whether they're communities of color or young people or immigrants, the poor, whatever the group is that you are trying to work with and create change with, why are they not participating at this point? So we've got time availability, some challenges in how to reach them, planning around schedules. Yes, absolutely, absolutely. Resources is always going to be a big one. Absolutely. They have lives that include none of what we're doing. Absolutely. Some difficulties with the populations that we're working with. So literacy might be an issue. Lack of documentation might be an issue. Absolutely. Absolutely. And a big one is distrust. Folks walk into these spaces with a history, and sometimes that history includes things that have not gone well in the past, whether they were with your organization, your work, or with society in general. And we have to be cognizant of that. I was at a workshop a couple weeks ago where the former superintendent of Chicago Police talked about that police have to have an analysis across race and working with African American communities that includes the history of African Americans in America. So he talked about 400 years of slavery, black codes, Jim Crow laws, all the ways in which folks have tried to get around civil rights laws and so forth, that those were societal racism issues that police were asked to go and enforce. And so the space that police had with those communities was about enforcing things that were unjust. And so that's the history. Uncovering some of that is really important as you're having these conversations. What has been that history? What are the historical injustices? And competing priorities. I think that's a very real one as well. I want to talk about two other ones that I didn't see come up. These are a little bit more internal about us. Paternalism and pathologizing. Paternalism is an important one to kind of note because we're really not here to do this for someone else. We are working with priority communities, and our best, we're being led by priority communities, and always, no matter what the work is and what we're doing, we're being accountable to those communities. We can't know what's best for someone else. We can know some of the things that we've seen work somewhere else. We can bring some information and some data, but we really have to be careful that we aren't feeling superior or acting superior or being perceived as superior by the communities that we're working with. And I'm being really direct with language because it's important that we note that our expertise and our professional space oftentimes creates a distance that paternalism then takes over. And I think we can be better at creating relationships with communities that aren't paternalistic, that we don't know what's best for them. We're trying to figure out what that is with them. The other one is pathologizing, and I hesitated to put this in, but I really want to make sure that we name it. And that told me that I was a little uncomfortable. That means that we needed to do it. And health equity work, when you feel the little butterflies in your stomach, it's a good sign. There is not something wrong with these people. And if you say these people, then that's the thing that's wrong to start with. And so we can't localize the issue in the people that we're working to help support and the folks who are experiencing the inequities. The problem is not with them. We are looking upstream at systems. We are thinking about what is in place that perpetuates the inequalities that we're seeing. What's in place that keeps those inequalities in place and perhaps exacerbates them, exacerbates what communities are already facing. That's the space that if we need to find blame or if there's a space that we need to point towards, those are the spaces that we can be looking at. What folks are experiencing are the conditions that are environmental. And some of you may be thinking about some of the behaviors that people express, but let's not divorce those behaviors from the environment that they're in and the kinds of things that they are exposed to. I don't have a soda in front of me right now because I'm trying to be a good public health leader and I have my water, but I know that I want one. And I want one because I've seen the Mountain Dew commercial more times than I've seen a water commercial. That's the simple truth. It's marketed to me, whereas my health is not. So that's an exposure. If I spend a lot of time blaming myself about drinking things I shouldn't be drinking, I will lose. That's not going to help me. And if you spend time blaming me, then we're not going to get anywhere. But if we can change the condition around it, if we can change the marketing, the exposure, the environment, then we start to do something well. And again, I wanted to name the pathologizing because sometimes when things get really hard, we go to the place of blaming the people who are experiencing the difficulty. And we have to make sure that we're not doing that there is a space for that. Thank you for some of your examples as well. I see a comment that I want to check on is a good lesson learned a while ago when someone said to me, we don't need yet another white woman trying to help us. What I would say to you is that there is an analysis that goes across race that names that particular helping. And that's really about a history of helping from the outside as opposed to doing with. And so what that person needs and should really have included is what would they like to have? Because it's not your race, it's actually the help that you're bringing. And making sure that we're naming that piece. You have things to offer regardless of who you are in that space. We're going to move forward to jump into making this kind of work. These priority communities are only going to be engaged if we can build really lasting and powerful relationships. We need those relationships to recruit folks. We need those relationships to deeply engage them, to keep them included, and last and most important, that they actually get to have some power. You'll see I put the parentheses around empower because really it's folks need to be able to take the power themselves, and we want to create the conditions within what we do that power is available and that folks feel comfortable taking it. And that includes leadership. I'm going to dive into a few of these as we go forward, but I think I have a more specific question for you. What barriers to recruiting and engaging priority communities are you facing? So what barriers to recruiting and engaging are you facing? I'll ask you to just try to be really specific about that piece around recruiting and getting folks in the door. So take about 30 seconds or so to see if you can relate some of the barriers that you're facing. All right. Take another 15 seconds or so you try to add a few more barriers. All right, 5 seconds. Great. You can keep going. I just want to highlight that folks had barriers around language, around outreach, trust and history, as we heard before, requirements, getting information to the priority communities, competing priorities, and obviously time. I want to talk about language a little bit. If we're not able to help folks to own the information and the process, then they really can't be engaged by it. So that might mean that you need to have and build some language capacity, whether it's your own language capacity within the groups or the ways in which you run meetings or the ways in which information is disseminated. And then also, are there ways to support language across the different groups that you're working with? Many of us are working in really diverse environments where there are multiple languages spoken. So we may not be able to translate into all of those languages, but having a sense of the linguistic capacity of the folks who you are trying to reach will also help you. So you may be only able to translate into a few languages. Can you figure out which of the languages cross into different linguistic communities, for example? And then building some partnerships with the folks who are serving those linguistic minorities so that they can be a conduit and that they can find you folks who can participate within the process with the folks who maybe you're struggling to provide access for. The trust issues are some of the thorniest things that you'll ever run into. Part of building that trust is creating spaces where people feel powerful, creating spaces where they see the accountability, and also spaces where they see that they are being listened to and are being heard. Doesn't mean that you throw out what your board says and now you do only what the community says, but creating spaces where they see that what you heard from them has been presented to the folks who are making decisions, as well as creating spaces where they get to be in dialogue and conversation with the folks who are doing the decision making. But I think that's a really thorny one, and it's important to build trust in small ways and start to build the relationships that allow that trust to flourish. Something as simple as a personal individual invitation to a meeting. I want you to come to this meeting. I need your voice to be a part of this, can go a long way instead of the big email we send out to 100 folks and hope somebody shows up, especially when there's lack of trust there. So you want to use and build that relationship to get there. I want to talk a little bit about what we mentioned earlier, which were some intentional and unintentional barriers. So some intentional barriers that we have here, and we're not evil people. We're not, mean folks. We didn't. We don't mean intentional, meaning that we were trying to keep people out. But these are things choices that we made. So some of these are operational, like when is your meeting? When are you doing the planning? Who is involved? Who was written into the grant, for example? We create those barriers as this is who's supposed to be a part of what we're doing, when really that should be a minimum of who should be engaged. So if you have a partnership and you've got 2 or 3 different groups in that partnership, it doesn't mean that they're the only ones who can be involved. And creating spaces for other folks to be a part of that can only really benefit what you're doing. You may need to build the capacity of your organization to be able to take on those greater number of partnerships, but that will help you to engage more of these priority communities. Contextual barriers. So what's part of what you're doing that you may not be able to step away from? Are there barriers to engaging in specific issues because of how you're funded, for example? Some of the faith-based organizations struggle with what they can do and what they can't do. Some of the organizers that are working in traditional communities find that some of the barriers that they have in terms of the liabilities and licensing that they have in their organizations create contextual barriers to the folks that they're working with. Then there are unintentional barriers. In here I would put all of the kind of historical barriers. So a community that I know is severely divided between East and West, and a group that was trying to organize a meeting put the meeting in the east side of the city. You would think this wouldn't be bad. They had no part in the history before, but just because it was over there on that side, a lot of folks didn't show up. Some of you may have done this before too. I know I've been guilty of it also. Ignoring that history makes it really difficult for folks. It may take a little bit more. You may need to still have the meeting in the same place, but you may need to do a little bit more to get folks from the other side to be there. The cultural barriers can be hard to notice because you may not know that that's why someone's not showing up. I know that working with young people for a long time, there were some cultural groups where I hadn't talked to the right person, so none of their young people would ever show up. No matter what I did, I could be the best program ever, they were never going to be there because I hadn't talked to the cultural kind of liaison in that community. There may be aspects of how you're doing what you're doing that cross those cultural barriers or are deflected by those cultural barriers. So a very public meeting for people who are culturally not used to being in spaces that are large groups or publicized or that are being videotaped and so forth. Pictures, asking, can I take your picture? Can pictures be taken? That can be a space that crosses some of those cultural barriers. And then obviously the topics that you're working with. There are some really brave folks out there who are trying to do really amazing conversations and doing the work to support some challenges in communities that are culturally not or historically not engaged in these kinds of issues, whether it's birth control or obesity, diet, any of these issues that are usually kept at home. Folks who are not used to having those conversations find it difficult to have in public space. So finding ways to bring those conversations home to those folks is what we're going to really be talking about, and making sure that we're aware of why folks aren't engaging and maybe doing some digging into what those might be. The other spaces are that, the ways in which we communicate might not be welcoming or might not reach the folks we're trying to reach. So many of us have stopped using like the phone, for example, to call people to come to a meeting. We send email. We've stopped using the post office. We don't send hard invitations. We tweet. We Facebook. We Instagram, and I'm sure there's something else that I don't even know the name of. And that works for a set of the population and doesn't work for another set of the population. And those, again, these might be some of the cultural barriers that we are unaware of, that maybe aren't getting through to the folks that we need to get through. Talking to the right person, making sure that we are using methods that actually reach the audience, and then being aware of what the history has been, what people haven't done. There's a funny example of a program that used the word crusade in trying to reach a Arab population. No one came, of course, because that's not a word that the Arab population would see as positive. And when it was demonstrated to or shown to the person that this was the reason why folks didn't attach to it, it was hard for them to see it because they had never seen this as a word that would come across in a bad way to folks. Again, the best thing that that person did was to go and do some direct outreach to folks to say, I didn't know that that word would be offensive, and to ensure that folks understood that there was no connection to any religion or historic pieces in what they were doing. We will sometimes knock into these barriers without knowing, and important that we pick ourselves up and move forward from there. Right. So one of the biggest challenges to recruiting people from diverse communities into the spaces that we are trying to get them in is that they may just not be where we're used to looking. So this is our friends in Madison, Wisconsin, and in no way, shape, or form am I revealing anything that they wouldn't gladly put up themselves. This was in the paper there. It talked about the disparity in terms of race, in terms of top business leadership in their area. And so you can see there in terms of the general population is 85% white, but the top business leadership is 96.5% white, and even supervisory positions are almost 95% white. And so if you were trying to put together a coalition that you wanted business to be a part of, going to business leaders, you may not get a racial representation that fits the area that you're looking for. And I use this as just an example because it shows up in lots of places where traditional leadership has not caught up to the demographics on the ground. And important that we're not discouraged by these things, but are willing to go and seek people in some other spaces. We're going to talk about that in a little bit. But I wanted to say that that was something that we want to make sure we're looking in the right place. So recruiting. We have to see these communities as essential partners. And that means that we can't do the work without them. That's what essential partners means. They have to be a part of what we're doing in some way. They are interested parties. It may seem sometimes that folks don't care about the issue that you are putting forward. More often they care very much. They just also care about some other more pressing things. And finding some folks within that community that you're targeting who care about this or who are willing to work on the issue that you are putting in front of them is what you're looking to do. And you can often find some of those folks by asking the people who seem disinterested, who they know from their community who might be interested. Also offering varying levels of participation. If I ask you to commit to a weekly meeting on Thursday nights for the next 6 months, you might hesitate. But you might be willing to come to a monthly meeting and then make up your own mind about whether or not you want to participate more. It's really important that we provide different levels of participation so that people who are traditionally shut out of being part of these conversations have a way to have their voice be part of it. So whether it's a one-time community dinner that talks about these issues or quarterly opportunities for people to come together and provide input, or monthly meetings, creating different levels so that folks can participate and that their voices can be part of the process. So some strategies for recruitment and engagement. One is always to engage the existing community and civic structures. So what are the cultural groups that folks are a part of? If I'm looking to reach the Cambodian community, I know that there are cultural groups that are centered around Cambodian culture. I will approach those groups to see if there are people who I might be able to tap to help me find leaders who would be a part of what I'm trying to do. Religious organizations oftentimes have created their own leadership infrastructures and opportunities for folks to be a part of that religious community while doing things that are perhaps less about religion and more about community. So in our work, it's always important to see if there's a faith-based organization that has a health ministry. Are they doing ministry around elders and young people? Are there specific areas of their particular organization that focus on things that are related to health that we can take advantage of, that they can send their leaders and that we can maybe harvest some leaders for? Business groups. We're used to going to the Chamber of Commerce or the Business Association. Oftentimes the targeted or the priority communities that we want to reach are not part of the Chamber of Commerce or your local business association. But they are part of, and some of those businesses are part of their own business associations or business groups or networks. So I know in New England and actually in a lot of parts of the country, there is a Black Pages, which is the white pages or the yellow pages. I know phone books, some of y'all are like, what is that? A phone book of just Black-owned businesses across the states nearby. And that gives you a sense of what's available around you, but also what are the networks, what are the organizations, what are the businesses that are in your area that you might be able to connect with. And not that you're going to be able to call up John Smith from Smith Accounting and get him to participate, but you want to tap him to see what are the spaces that he is getting together with his community that you might be able to harvest some leaders and participants from. Advocacy and service networks that are supporting the groups oftentimes are already working to empower members of those priority communities, and so one way that they can build leadership capacity is to participate in some of the things that you're going to be doing. And then education, recreational, and support services. Groups, no matter who they are, typically have ways in which they are coming together to provide educational opportunities, provide recreation and support, sometimes through organizations that represent their own space, other times through organizations that are serving specific groups or finding ways to support those individual groups or those specific groups. So a strategy that I'm really fond of is co-chairing. And beginning from the outset with really visible leadership from the targeted community. So if you are chairing the meeting, is there a co-chair available who is of the targeted community? Can they chair the meetings either with you or chair the meetings together? If that's not available, are there task groups? Are there subcommittees that members of the priority community can help to chair? This is a leadership opportunity, but it's also a way to ensure that the voice of the folks who are being impacted by the inequity are part of what your community is doing, part of what your group is doing, and that they have real decision-making power. Another strategy that I'm really fond of is 51% of the room. Can we create spaces where more than half of the room are the people who are experiencing the inequity? It may not be that you can do this all the time, but it should happen at some point where the majority is the folks who are experiencing the inequity and that they then get a chance to really lead and be powerful in that space. This one's important because we don't want to have situations where we are have one person who is part of that group and that we just shuttle them to every opportunity. We don't want to tokenize folks, and we don't want to have one individual feel like they are supposed to answer for the entire group. So finding different ways to have different people play these different roles, and that you want to spread the leadership opportunity so that it touches the different parts of that priority community, because they are not monolithic. There may be members who disagree about the issues that you're working with. So you want to get all of those opinions to be a part of what you're doing. There are some, here's a wonderful picture. I just wanted to put it out there that there are folks all over who might be a part of what you're doing. So if you're not able to find somebody in your direct community who can lead, it is always the best case that you're getting somebody who is right there. There may be somebody right next door who might be able to be part of that, and that by bringing them in, you might be able to build a relationship with the folks who are in your community who might be able to be a part of your group in the future. So some bigger barriers: gender, race, and class. Gender is really important to kind of start out front with because it gets forgotten quite a bit. We want to make sure that we are creating powerful spaces for folks across gender, and it has to be something that you decide and you focus on from the beginning. Race is another one that's very noticeable. You can kind of walk into a room and know whether or not they have worked to engage racial minorities in their community pretty easily. And it also is important because it gives a better window into historic disenfranchisement in that community, but also the inequities that people are facing. And creating spaces where the people in the room who are representative of that societal mix that's in your community also get to build relationships across these differences and be led by folks that they are not always led by in the rest of the spaces that they go, whether that's across race or gender. And the last really big one is around class, and I think this is one that we often forget. The simple piece is that the opportunities to be engaged vary widely based on how much you are able to give time to things in your community. And some folks who are working 2 and 3 jobs, they may not be able to be a part of many of the bigger, broader things that you are doing. Or your meeting just is at 5:30 and they take 2 buses to get home from their job. And that's the only way they can get to and back, so they're not going to be able to be a part of it. So creating spaces that recognize that folks walk into the processes that you have afoot with different economic opportunities. So that might be things like providing lunch and daycare. It might be making sure that you're having meetings at times when people are available to be a part of them, and recognizing that not everyone has the same kind of social control in terms of their jobs and other things in their lives that allows them to give what you're doing the priority that you would like to have. The example I use for this all the time is that I'm on a board where everyone else is pretty much either a senior level person in their organization or the senior level person in their organization. And so when they want to meet at 7:30 or 8:30 or 9, whatever time they want to meet, they just put it into their calendar and that's when they're doing it. Whereas I work in an organization where I have other responsibilities and have other folks who might have a say in my schedule, or there are things that are happening that I can't not do. And so that's very different. So I had this conversation with the chair of that board to say, you know, you have to recognize that there are differences in socioeconomic class here and professional class that makes a really big difference in how folks are able to be in the space. And that helped her to understand that I wasn't just not showing up because I didn't want to be there or had something else to do. It seems simple, but it's a really important way to recognize that not everyone has the same kind of social control that some folks experience. Communication style, and this again can be really important because some of the folks who you're working with, especially across difference, have very different communication styles than what you might be experiencing. So A is to find the right communication method. Flyering is awesome. Putting something at someone's door is great. But if you live in a community where people don't usually put something on your door, you probably aren't even looking to see that it's there. You go right by it. Email seems to be universal, but most folks still don't have an email address. So that's something to think about if you're trying to reach people. Not everyone is using that same method. And that goes the same for social media and so forth. Don't use declarative statements and limit expert talk. When you're communicating across difference with priority communities who are walking into a space that they may not have as much power with in the beginning, declarative statements or ways in which we provide expertise as absolute information really is disempowering and turns people off. Why do I want to be here if you believe you know everything and that you have all the information? So really making sure that we have folks be part of the conversation and that we are using language that invites their participation. So I want to give you 3 easy steps. Instead of saying that, for example, African American children are twice as likely to get hit by a car and die from their injuries as white children. Instead of saying that up front and presenting it as fact, and I have the research to show you and all the things that I would need to do that, I might introduce the issue first and say, have you seen young people being hit by cars in your neighborhood? Is this a problem in your area? And allow people to talk about that. Allow them to reflect on maybe some data that you have about what happened last year. There were this number of young people hit by cars. And then allow them to reflect a little bit on how that feels to them. Is this something that they care about? And then sharing the discrepancies there in terms of who is suffering from this particular issue and how it's different across race, and allowing people to have that conversation there. The only thing I did there was to switch the order of the conversation. But what it does is allow folks to not feel like they are being pointed at. Because if I start with African American children get hit by cars more than twice what white children do, if you're an African American parent, that might be something that puts you on the defensive. So we want to start with the issue, share the information, give time for folks to think about it, and then present the data in a way that allows folks to find the meaning in it and then decide if it's something that they want to get in front of. All right. So that was really around recruiting and engaging, but I wanted to spend the last bit of our time together with thinking about including and empowering. And again, we're building this on relationship. So I've got a question for you. What challenges do groups have to sharing power with priority communities? And I want you to be specific about what challenges you have to sharing power with the community that is facing the inequity that you're trying to work on. We'll give folks a little bit of time to try to answer that. All right, not all at once now. What challenge do groups have to sharing power with priority communities? So we're hearing about sometimes the outcomes have already been decided. You You have to write the grant to get there, yep. Pride, our own pride, absolutely. Trust comes up again, yep. I really want to appreciate some of the honesty with which people are naming this. One is the professional challenge of we have the information, so shouldn't we have more say in what the goals are? And what I like to say to folks is that we have our piece of the information. I've got 90 to 95% of my piece of the information, but that 90 to 95% isn't the entire information. And I certainly don't have a lot of the group that I'm trying to work with's information. And that's the space that we want to get to. Privacy can be a really big concern and fear. The groups that we're trying to work with may have their own agenda. That's a good one. Take about 10 more seconds there. What other challenges do you have in sharing power with priority communities? Time is always a big one, absolutely. And if we're really honest with ourselves, there's a little bit of, and folks said in pride, we want to be seen as the experts. It's part of our role sometimes to be that resource. If we're really doing it well, we can be a resource that's recognized without being revered. And someone was really honest about the competition with other organizations. Absolutely. Absolutely. Appreciate that. If we do that analysis of the 4 key questions, we also surface that those who have benefited sometimes are in power and are giving resources and the power to do the analysis themselves. And trying to figure out how to do this and get really good outcomes can be difficult. I want to say that, oftentimes we end up working on 2 fronts. One that is about engaging and really sharing power with the priority communities that we are working with, and then the other front on trying to expand the opportunities for that same priority community to really lead and be part of the decision making that oftentimes we're not a part of. So that's very real. Thank you all for those answers. They were very, very thoughtful. A lot of what we're facing, issues of justice and fairness, issues of inclusion, understanding, are things really fair, access, what kind of participation, and if you look in the, into the further background in there is like transportation, some really basic things like I would ask folks to co-chair, but they don't get here till the meeting starts. There are social issues about how people are perceived. Lots of different issues come up when we start to unpack why we don't share power or don't do it as well. And that it's not always comfortable. It's not always comfortable. So I want to dive a little bit deeper into the inclusion and empowering. First off is we've got to be upfront that these communities need to be part of the decision-making process. Ideally, they're there in the beginning when we're doing kind of the analysis. They're a part of the solution making, the implementation, and the evaluation with great accountability all throughout. But definitely at those spaces of decision making, we really need to make sure that their voices are part of this, and this is also about building buy-in, and then balancing what we just talked about, professional expertise with lived experience. We may have a lot of really good information and a lot of experience with interventions that we're trying to propose, but we've never lived the lives that they have lived. And the balance of their experience with our expertise has to get a little closer to 50-50 so that we honor what they bring just as we're asking them to honor what we bring. All of this really comes from, again, having an analysis on race, power, and poverty. If that analysis is clear, then the other things can fall from it. Our friends at the YMCA, I'm sorry, the YWCA, I don't believe I made that mistake. Our friends at the YWCA, their analysis is really clear. Like, they put it on their t-shirt, end racism, support women. That's their analysis. It's what they are doing. And again, they looked through what they were about and decided these are the spaces. This is what we need to be working on. Your analysis on race, power, and poverty can be very specific to the group that you're working with, their particular history, and the context within which they find themselves vis-a-vis or in respect to the inequity that they're facing. But it needs to be clear, and as much as possible, be something that everyone can see. These are the reasons, these are the things that are in place, and something that we can name and work on. Some communities I know that are working on some of these issues, including our friends in New Orleans, they have put up front the history of redlining in their community. They've put up front the history of unequal policing in their community and said, we didn't get here by ourselves. These are the things that are there. And that simple set of statements have helped people to not pathologize and blame folks for the conditions that they find themselves in, and to ensure that the lived experiences of the folks there are brought forward. They do things like storytelling up front to allow folks to have a space for the stories of the inequities that they've experienced and where those are, as well as where things have gotten better. We want to move a little bit to thinking a little bit about where we left off from last time. We have to be willing to see what it is that we are facing. All right. We did this in the beginning, and I want to make sure I touch on it. We have to be willing to see that it's there. We have to disaggregate the data. All right. So as much as you can, create spaces where you can get down to the level that the population that you're trying to work with. So if it is Latinas in a specific area, to get down to that geography and that subgroup, gender and culture. If it is African American parents, then get down to the how many African American parents, where are they, what ages are they, how old are their children, all of those pieces. And it may mean that you have to do some additional data gathering to be able to have the data that you need to do the analysis that you want. And that gets down to, again, being able to do the analysis on race, power, and poverty. Discomfort. These are not always comfortable conversations. That analysis would allow you to start this conversation. Now, the first thing is to really be willing to be uncomfortable. What is it that is going to make folks in your community uncomfortable? When you do the 4 key questions with folks, right there, some of the people in your room might be named in the who benefits. That will create some of that lack of comfort. Being willing to challenge yourself about the things that you have been a part of in the past, that you continue to be a part of. Making sure that you examine your own guilt and that can't be the conduit for these conversations. I feel guilty as a man about my sexism and the kind of privilege that I own because of my malehood. But if I walk around with that, then I'm actually not doing anything to engage and empower and provide conditions for women to be more powerful. I have to be willing to put that aside, have an analysis, put it aside, and concentrate on creating equity. I like to do pre-meetings and conversations with folks before the discomfort comes into being, or having those conversations with folks after you've noticed that maybe they were a little less than comfortable. Not letting it ride, really making sure that you address it with folks. If you have described norms for the group, making sure that you live those norms, reflect on them, and celebrate when your group has done them well. We really listened to one another today. We really created a space for difficult conversations today. Finding ways to reflect that back to the group and allowing them to also reflect on it. And asking what the, folks will say what's the elephant in the room? I'm not sure where that comes from, but asking the priority community what has not been talked about, what seems taboo that you want to make sure is part of the conversation, and then finding creative ways to bring that to the front. Last but not least, one that I like to put forward to folks, most people are familiar with I statements, so when you are asking people to share their experiences and to speak about the issues, to use I statements, and to focus on experiences, not intentions. So the police didn't do this because. You can say the police did what they did. You can talk a little bit about majority communities do X, Y, and Z, not majority communities think X, Y, and Z. And that focus on experience and I statements will allow folks to talk about what their intentions are if they're on the other side of that line. A simple experience I've had is working with police about some of the ways in which they approach young men of color. The police officers were willing to talk about the things that they experience and the heightened levels of fear that they experience when you start the conversation with, here's what I see when this happens. They go right to their training and what they've been experiencing. I like to put it out there that there's a space for understanding if we are willing to not infer what the intentions of the other are, but allow them to share what their experience and what their ideas are. Challenging your comfort zone, knowing what pushes your buttons, and becoming familiar with what pushes the envelope with your group. Is it race? Is it class? Is it history? Is it geography? What is it that pushes the envelope with your group, and being willing to go up to that point and have that conversation. And always return to the norms for your group. So if you've had a heated conversation, making sure that you go back to your norms and talk about with the group what you might do better next time and what would have helped them to stay within the norms that you created. It's not that you don't have the conversation, it's that you find ways to have the conversation better. Here's a group of folks who are owning it. The change that they're trying to make, they are a part of. I just really love the guy in the yellow shirt up front. So I'm just going to tell you up front, that's why we have the picture. But this idea that it's intergenerational, that it's across race and culture, and it's an opportunity for folks regardless of who they are. Owning it is that we own it together, that priority communities are not the other, and that inclusive solutions are better solutions. We've got to start with that belief so that we'll actually do it. I want to give us some time for some questions. We got about 5 minutes or so. So if folks want to light up that question box and send us a few questions, we'd love to take a few. So one question I get asked all the time is, how do we engage and involve young people if the disparity of the inequities are being faced by them when they aren't always a part of the things that folks do? Some of the simple barriers that you can get over are things like, when is the meeting? So making it space and a time where young people can get to in a time that they can get to it, having it in a space where they are already, and this could work for any community that you're trying to reach. If you're looking to serve the Latino community, you might go to a space where the Latino community already goes, or a space where that community already is. If you're trying to address obesity within an immigrant population, having conversations with that immigrant population, large conversations first, and then getting, or broad conversations first, and then getting to the narrow topic might help you also. Other questions? How do you talk to city officials about engaging community members in the planning process? That's a really good one. So two ways to do this. The first is give them some examples of how other cities are engaging residents in the planning process. So two things that are going across the country right now that are really powerful. One is participatory budgeting, where folks in the community are making decisions and giving input to decisions about capital budgets. Sometimes it's a broader set of things. Sometimes it's a narrower set of things. So that's one way. And then another way is, are there groups that are already engaged in the issue that can meet with those community officials or the elected officials, and especially if there are groups who are impacted by the decisions to be made, that they are part of the process and are engaged before the decision is made for them. And also inviting those city officials to be part of what you're doing. They may not want to join your coalition, but they could come to the April meeting where you're going to be talking about the thing that your group wants them to know about. You can give them a space to be part of what your agenda is, and also a way in which they connect with folks who are in their community that they may not always connect with. Other questions? Anything else that folks are struggling with? Got one here. Suggestions on how to build trust if the trust is not there. All right. So I really enjoy this idea of trust building, because it's one of the things that we all know how to do individually, but we struggle with how to do professionally. So I'm going to say to you that it's always about relationships. So going and building a relationship with an individual who can be an ally for you into the community that you're trying to work with. Finding ways in which they can participate that don't cost them anything or cause them anything. So can they be part of what's happening in your community? Can you invite them to something broader that's not about the issue? Can they be somebody who you build a relationship with before you have to target the problem? Thus, they are part in seeing what you're doing and building some knowledge about who you are and what you do. And if something has happened in the past, to be willing to have that conversation up front. Whether that's a community dinner where people get to talk about the things that went wrong in the past, and the organization or the different factions that might not have trust get to talk about how they could work together in the future. Those are often facilitated processes, and so that might be something that you bring somebody in to help facilitate, and that would give you a space to step back and really be part of the process. I'd also say that when the trust is not there because it's a system and community, you may need to spend a little bit of time in that community with the trusted leaders to see if they can give you some of that allyship to help bring the community on board. Find out who they already trust and see if you can build a relationship with those folks. And I would say be upfront that with the people who they trust already about what you're trying to do, that you want to engage and involve them. You don't have the kind of trust and relationship that you need now, and that you want them to help them to do that. And be ready to do something with and for that community before they do something with and for you. Yes, I come to Maine. Email me, Danielle. Any other questions? I think we're coming to the end here. I want to thank you for investing the time and for really thinking about priority communities. I hope that I will see you all next month, and Daisy's going to tell you a little bit about that.
Awesome. Thank you so much, Mo, for that great information, lots of critical questions to think about, and also to you all, not just for your great work, but your great questions and how you're struggling to really think about this critically. So thank you all so much for participating. And like Mo mentioned, he will be in person continuing a very important part of this conversation, which is power dynamics and health equity. That will be in Worcester in April, and there's more information on that on our website. And in that morning, there's a session on facilitative leadership that you're welcome to join us to. There will be a networking session there midday, so you could definitely engage with us during that time. And again, those May webinars that are coming up, in particular, priority population that maybe you are engaging or thinking about engaging, which is young people. So we have a webinar coming up in May around that. And also communication tips and tools. So really some folks who do communications work to really help you think about how you talk about what you do in an effective way. So again, all that info is on our website, and you can also sign up for our newsletter if you're not already on there via our website and these many other avenues like texting that number. There goes our email and again our Twitter handle, and we're also on LinkedIn. So we'd like to thank you again for being with us this afternoon, and we'd like to thank the Massachusetts Department of Public Health again for making this webinar available for free for all of you all. Thank you so much for joining us. Don't be shy about contacting us with any questions or comments, and have a great day.